Welcome to Engaging Leaders, a Leadership Maryland podcast brought to you by Beacon at Salisbury University and BFG Financial Advisors. Since 1992, Leadership Maryland has been connecting and empowering leaders through transformational experiences, dialogue, and education. Each month, we host candid conversations to promote positive outcomes in your organizations and communities. I'm your host, Eric Brotman, and I'm joined by my co-host, Renée Winsky, the CEO of Leadership Maryland. Renée, welcome to the show.
Thank you, Eric. It's a pleasure to join you today.
We have a very exciting guest, Renée, and I'm going to let you introduce Dr. Accius. This is going to be really exciting. So, Renée, if you would introduce our guest.
Sure. So joining us today is Gene Accius, PhD, Dr. Gene. He is the Senior Vice President for Global Thought Leadership with AARP. He is also a member of the Leadership Maryland Class of 14. He is a lifetime member, and he's a member of our Board of Directors. Gene, welcome to the show. And if you would, just tell us a little bit about yourself.
Well, first of all, thank you so much, Eric and Renée. Renée, I'm going to have to give you a call every single day. You just made me sound much more important than I really am. But I just want to, first of all, say thank you so much for the opportunity to connect with you and Eric today. I am a leader that really has been focused on thinking about ways in which we can and should create systems that really benefit the lives of millions of people. It's very mission focused. It's a professional commitment as well as a personal commitment. I mention all the time that I was raised by my grandmother for the first 4 years of my life, and that really sparked my mission and sense of purpose in giving back, particularly to people as they age.
Very good. Very good. So I want to talk a little bit about the crisis that we're in right now. And as the global thought leader for AARP, what are the principles of a good leader, particularly in a time of crisis, that you see?
I think there's three crises that are taking place at the same time. One is the COVID-19 pandemic. The other is the economic crisis as a result of the pandemic. And then, of course, what we're seeing across not just the United States, but also with respect in other countries, the growing social and racial unrest. And all of this is happening at the same time. And I think it's critically important for leaders, particularly during environments of uncertainty and significant ambiguity, where anxiety is at an all-time high, that it's important for us as leaders to really crystallize, to the extent to which we can, what the path forward might be for the teams that we're leading and the people that we're serving, to the extent to which we can communicate and continue to communicate. In fact, it is during times of crisis that you really have to crank up the volume with respect to communicating with those you lead, both in terms of what you know, as well as being honest about what you don't know. I also think it's extremely important as leaders for us to really think about the opportunities, even during a crisis, to think about ways in which we can create solutions to really ensure that we become and we are better off after the crisis. And I think that as leaders, it's critically important to be able to crystallize what that vision and that path forward may be, and to really bring your team and those you serve along with you. In fact, those who are closest to some of the challenges that we are seeing should also be part of the co-creating process to ensure that we are actually getting this right. So three key points is: one is to always communicate. Two is to inspire and encourage your team and also those you serve to join you in part of creating the solutions. And three is to be honest about your own vulnerabilities as leaders. We don't have all the answers, and we should be able to communicate and share that. And I think that there's a sense of appreciation when you say, you know what, I actually don't know what next week might look like. But what I do know is that we have an opportunity to work together today to ensure that whatever happens next week, we're in a much stronger position.
Gene, you hit on the three simultaneous crises, and all of them sort of have a confluence with two groups, two populations that are disparately impacted by all of this. One is minority populations, and the other is older populations. So there's this really interesting intersection between all three of those things that hit those two populations perhaps harder than others and are certainly creating greater economic inequality than ever before, or at least highlighting what was already there. Can you talk a little bit about not only racial equity in aging, but also just in general, the impact that these three events are having on those two populations specifically?
Thank you so much for that question, Eric. I think you're absolutely right that COVID-19 did not create the disparities in some of the inequities and disproportionate impacts that we're seeing, both as it relates to communities of color as well as it relates to particularly the growing number of deaths and infections that we're seeing in long-term care communities within the U.S. It only accelerated and brought to bear many of the systemic issues that has long existed. And I think we have two options. One is that we can look at this and really put some patchwork solutions to try to address some of the inequities that we're seeing. Or we can be bold and courageous as leaders, working across industries and sectors to really reimagine and rebuild, and not just rebuild, but rebuild better and stronger. When we look at the nursing home and the long-term care situations in this country, I will note that this is not a situation that's unique to the United States. 50% of all the deaths in Europe occurred in a long-term care facility. So it really speaks volumes in terms of exactly what do we need to do as a country, as leaders, to ensure that people are receiving high-quality care as they age. That could be you, that could be someone you love who is in a long-term care facility. But how do we ensure that? And what do we need to do to design systems and programs that really help to ensure that people can live a life of dignity, purpose, and independence? I also think that the intersectionality is critically important, as you noted, that what we're seeing are some tough conversations that we need to have with respect to economic as well as racial equity. And what does that actually look like as we move forward? And I think that the way and the path forward is to really start to have these conversations, and not just have these conversations, but also to spotlight innovative models and practices that has taken place in pockets of the country. And then finally, I do think that as leaders, we need to think about the connection between the organizations that we lead and some of the inequities that we see in our society. And what I mean by that is that it's very difficult if leaders within their companies are complacent about the issues of diversity, equity, and inclusion. They are by its own nature complicit to some of the racial and economic injustices that we see. If you're looking at your organizational structure and there's a large concentration of women or people of color in a certain category, and it's not distributed throughout the organization, I would implore you to really kind of think about exactly how can we start to diversify that? Not diversify that for the purposes of diversity's sake, but because there's diverse talent. And the question is, to what extent have we as a society ensured that the opportunities are being granted to the vast majority of the population and not to some at the expense of others? And I think that's critically important.
That's a great segue to my next question. As a part of AARP's Social Innovation Summit that you're involved in, you had the chance to interview Wes Moore, CEO of Robin Hood Foundation. I watched that webinar. At one point, Wes said something like, "We are products of our expectations, not our environments." Fascinating statement. Could you elaborate a little bit on what AARP is doing with the summit, and then just give me your candid thoughts about how that conversation went with Wes Moore?
Well, thank you so much for that question, Renee. One of the things that we're doing at AARP is really to start to elevate the issues of equity, in part because of the fact that we cannot think about living a longer and healthier life if that is not necessarily something that is possible for all populations. So as a result of work that we wanted to do pre-COVID, we thought that it was critically important to ensure that as we have broader conversations and think and partner with organizations around what does it mean to live a longer, healthier life, we also need to be very cognizant and clear that that is not necessarily the case for a lot of populations. And as we start to create solutions to enhance quality of life, we want to ensure that the legacy systems of the past are not embedded into the future that we want to collectively create together. So we've been having a series of conversations with major leaders around what their ideas and thoughts are, what are some of the solutions with respect to really creating an environment in a society where people can live their best lives. And it's important for us as AARP because we want to empower people to live their best lives as they age. But we also are cognizant of the fact that there's inequities that prevent some from actually achieving that actual goal that we all cherish. So what can we actually do about that? And it's really a multi-sectorial approach with regards to the conversations that we're having, the relationships that we're building, and the solutions that we're creating. And we're so fortunate to actually have Wes Moore join us, in part because of the fact that what we've heard from the series of conversations is that place matters. Place matters, but it's not just that simple. In fact, it's a little bit more complex than that. We know that when you look at the United States, there's a 30-year life expectancy gap in this country. And in fact, the same common theme is seen across the country, that you can actually have two neighborhoods that are 2 to maybe even 5 miles apart, but have decades in terms of gaps in how long they're predicted to live, in part because of the environments in which they're in. So I posed this question to Wes in terms of exactly, are we a product of our environment? And he said, you know what, Gene, we're a product of our expectations, which is a function of our environment. And I said, can you kind of dig in a little bit more of that? And this is a common theme, in fact, that I've actually heard from other key leaders since my conversation with Wes, is the fact that what are the options that are available for individuals. So there's this collective responsibility, meaning the fact that in some cases the options that are available for individuals are more narrow than it is for others. So they're making decisions within an environment that has already predetermined what their options might actually be. But it's also important to note that despite the environment, that there are opportunities to really excel and to persevere. But we have to acknowledge the fact that these systems, whether at the community level or at the healthcare broader level, the healthcare system, or even our financial systems, that our choices are a function of this broader context. So it's really in tandem. And I think that's critically important to note, this idea that individual behavior in external context matters in terms of people's outcomes, and that people can only make choices from the options available to them. So how do we start to create more equitable options so people can actually start to make more decisive and intentional decisions? And I think that is some of the conversation that we're seeing more broadly, this idea of individual and social responsibility. And I think it's a mixture of both. And it was a very, very profound conversation with Wes, who just recently actually came out with his latest book around some of these issues.
Thank you for sharing that. And in fact, at the end of our show, we're going to let you give some contact information of how folks can learn more about you and about AARP. And maybe if you want, we can tee up the link for that webinar as well, because I have a feeling lots of people are going to be interested in listening to that. You mentioned something, Gene, if we can go back for a second. You talked about a mission to age with dignity, purpose, and independence. I don't know if that's AARP's or yours or a combination, but it's wonderfully simple and incredibly profound. I've found over the years there's a great difference between longevity and healthy longevity.
Yes.
Living longer by itself, if you're not living better, is not necessarily always a good thing. And one of the things that anecdotally we've found in our organization is that the retirees who are the happiest have three things in common. And I think you've actually hit on all of them. One of them is that they're debt-free and financially independent. One of them is that they've protected their health and they've taken care of themselves. And one of them is they have a reason to get out of bed every morning. So I think we're actually saying the same things. You more concisely and eloquently than myself, I guess. But can we talk a little bit about health longevity and this idea that living longer without living better potentially isn't a great outcome? And what do we have to do to help folks create a healthier lifestyle? I mean, I don't think you live from your 20s to your 60s eating fast food in your car between appointments or something, and then you suddenly turn 65 and you're switching to kale smoothies. You don't just become healthy. It's a lifestyle journey. It's a long-term thing. So how do we get folks to realize that the way you take care of yourselves in your 30s or 40s or 50s will dramatically impact your outcome in your 80s?
Eric, I first of all, I absolutely agree with that, and I'll tell you that at AARP, our enterprise focus areas are actually in three buckets. One is around health security, the other is around financial resilience, and the third is around personal fulfillment. So the three buckets that you just outlined in terms of being debt-free, about protecting your health and having a reason to get out of bed every single day, directly aligns with that. That you definitely want to think about the opportunities to remain healthy, the opportunities to have a financial safety net that's resilient, and then, of course, really thinking about those social connections, what gives you meaning, what gives you purpose in life. And those three areas of focus working in tandem, you see some of the outcomes that you've talked about. But you're absolutely right. We started maybe 3 years ago in 2018 having conversations across the country with people with a simple question, and that was, what are your thoughts about living to 100? And the feedback that we received was the fact that people were not necessarily interested in living longer. They were more interested in terms of exactly what would their quality of life be. The idea that would be, is it about having a healthier lifestyle? In order to actually do that, it's many of the things that you talked about, that there is an opportunity that really crosses industries and sectors, and it's what we refer to as the 3 Ps, that there's a personal responsibility in terms of having that healthy lifestyle, really trying to make some important decisions, particularly at early life stages, but across the lifespan. And then there's a public responsibility. How do we ensure that we have the necessary systems in place that is fostering and supporting those type of incentives? And then there's also a private sector responsibility as well. I think that employers see benefits with respect to supporting their workforce in these areas, because their workforce are more likely to be more productive, more engaged, and more willing to give back to the organization, society more broadly. So, in fact, the idea of moving away from just living longer to moving toward a focus on having a healthier, longer life is something that we've been championing as an organization, both within the U.S., but also globally. In fact, we, as part of the World Economic Forum, we've been engaging with our colleagues and CEOs with respect to this idea of really ensuring that healthy longevity is part of the broader conversations that we need to be thinking about in terms of private industry. And then also we've been working very closely with the National Academy of Medicine on what we refer to as the global roadmap for healthy longevity, to really drive home what would it take, what are the systems, what are the processes, what are the pillars, what is the framework that we would need to develop and adopt across sectors to ensure that people are living longer and healthier lives. And a big focus of the global roadmap for healthy longevity with the National Academy of Medicine is around equity, going back to our earlier conversation.
Renée, if it's all right with you, I'd like to ask Jean a follow-up.
Sure.
And Jean, it's actually a two-part follow-up. I'm going to give you a softball, and then I'm going to give you a hardball, okay? The softball is why don't more organizations, particularly employer organizations, have wellness programs, not just health wellness programs, but financial wellness programs, other types of whole person wellness programs. So that's what I consider the softball. The hardball is the 500-pound gorilla in our financial system feels like Social Security. And we haven't talked about it at all, but I'd love to hear your perspectives on not only why it's broken, but how to fix it. So a softball and a hardball, Gene.
Yeah. Well, Eric, being part of the first class and the best class in Leadership Maryland, I appreciate the two-part question. In fact, when I was going through the program, I would post 3 or even 4-part questions. So I just want to say, first of all, thank you for leading by example, my friend. With regard to the softball question, here's my response to that. I do think that in engaging with global companies, that global companies are actually thinking about the range of benefits that they actually offer their workforce for a variety of reasons. One is the fact that many companies are managing 4 to 5 generations, and they're thinking about how do they leverage 4 to 5 generations at one point in time, at any given point in time, in a way that benefits the workforce, the workplace, and their bottom line. And to that extent, what they've started to do is create what we refer to as ageless benefits. And ageless benefits are benefits that really helps individuals across the lifespan. So a good example is that you have some companies who are starting to offer caregiving benefits, and they don't actually connect it to a particular age. And I think that's critically important to note because of the fact that, contrary to popular belief, millennials are actually caregivers. In fact, over 10 million millennials in the U.S. are caregivers. So if you were to have some form of a caregiving benefit that only target a certain age, you could potentially be missing out on the great contributions that millennials bring to the workforce. So really think about those ageless benefits. I also think that in the course of the conversation we've been having with a lot of global companies, they're thinking about how can they create, invest, and ensure that their workplace and their workforce, that they're prospering. And what I mean by that is how can we create policies and programs and benefits that really addresses the holistic nature of the evolving workforce? And how do we invest in the workforce in a way that ensures that they are competitive, that they're reskilling and upskilling? And how do we ensure that as a company that the workforce as well as the workplace benefit through this? So I do think that there's a range of conversations that are taking place that's looking at the holistic nature of the workforce. And I frankly do think that COVID-19 has accelerated those conversations. If you think about it, pre-COVID, there were many companies that were slowly moving towards telework or remote work. Well, post-COVID, it happened overnight for many companies. And really kind of thinking about how do you manage your workforce in an environment where all of their roles are clashing all at once. I am just grateful that my kids haven't come down here and to put me in a headlock as you and I are talking. And I've been on Zoom calls where you've seen all kinds of interesting things. So I do think that those conversations, Eric, with regards to wellness programs, now clearly there are some privacy issues and there's that we could get into. But the opportunity to think about wellness programs, financial health are critical benefits that I do think that if companies are not thinking about, they should be thinking about as ways to support their workforce in a very meaningful way because of the fact that clearly, given exactly where we are with regards to the economic crisis that we're experiencing, that finances are top of mind for a lot of workers. With respect to Social Security, there's a couple things I would like to note on that. One is the fact that I do not think when we look at the financial systems in the U.S. in particular, that Social Security is a problem. I think that Social Security is a critical component of a program that has really helped elevate and ensure a significant number of people, particularly as they age, do not fall into poverty. Are there opportunities to strengthen the program? I think there are. But when you look at the full picture of what a retirement system should look like, it should be Social Security to the extent to which pensions, savings, as well as what we refer to as healthcare. So going from the 3-legged stool to a 4-legged, if that's even a thing, chair, it's critically important that you do need to have some form of a safety net to ensure individuals have the means to be able to finance their care, particularly when they're no longer of quote-unquote working age. But at the same time, that there should be other pillars to help supplement that. For a significant portion of our population, particularly in the U.S., Social Security is the predominant source of their retirement income. So we do have an opportunity to think about ways in which we can ensure that as people live older and continue to age, that they have the opportunities to really live a life of dignity, purpose, and independence. And one last thing I will say about this, Eric, is the fact that AARP was founded by a retired principal who went looking for her retired friend, and eventually found her retired friend living in a chicken coop, a shack without any walls. And that's a true story. This retired teacher had no health care and had no financial cushion and was really making tough decisions between her ability to take her medicine and the ability to stay in the chicken coop in which she was living. And outraged by that, she created AARP back in 1958. So thinking about what we refer to around health, wealth, and self, we have opportunities to work across industries and sectors to really create the systems in a way that ensures that people can really live that healthier and longer life, but also acknowledging that in some cases, for some people, that one of those pillars might exist and others may not. I'll use the example of remote work just as a quick, to really kind of drive home this point. I consider myself very fortunate to be able to work from home and to continue to be able to provide for my family. But I also realize that I have a position and a job that allows me to do that. For blue-collar workers or those who are on the front lines, they are making the tough choice every single morning as to whether or not they're going to leave their home, go work at the grocery store, potentially get exposed to COVID because they have to feed their families. So we do have to acknowledge that in some cases that we want to ensure that if the ultimate goal that we can all agree that people should live longer and healthier lives, that we need to create and ensure that there's adequate systems that would foster that, whether you are a blue-collar worker or a white-collar worker.
Renée, do you have any closing thoughts or questions for Jean? We're running out of time. Jean, this show should be an hour and a half long, but sadly it's not. Renée, do you have any follow-up or closing questions?
Jean, I had to keep from laughing when you talked about you and your class of 2014. And yes, you were always the first one to stand up, but your classmates took it in stride and loved you better for it. So take us home, Eric.
Very well. Jean, I'll just say a couple things. First of all, you handled the hardball adroitly, so well done, sir. I love your image of the four-legged chair. I will tell you that the three-legged stool for a lot of people has become, for millennials, we like to refer to it as having changed to a yo-yo, which stands for you're on your own. Because pensions are not frequent anymore, and because Social Security is at least perceived to be on life support of some type. But you give us hope that it's fixable, and I think it is fixable as long as you're not running for office and trying to do it, right? So, thank you for that. How can folks get in touch with you or learn more about you? Let's let you tee that up, and then I'll close the show.
Well, Eric, thanks again, and Renée, I really enjoyed our conversation. Folks can, reach out to me. I am available online and through social media. At Twitter is at Gene Accius. You can find me also at AARP.org. We have a range of resources and tools on our website, so by all means, feel free to visit us at www.aarp.org. And also, I'm also on LinkedIn. I really enjoy these conversations. I tell you, I am better as a leader because of Leadership Maryland and the lessons and insights that I've learned from not just my cohort, but also the alums that's come before me and the classes that have come after me. It's just been an amazing experience and that I'm forever grateful for.
Well, Gene, thank you for being on the show. You've been a great guest. And thank all of you for listening to Engaging Leaders, a Leadership Maryland podcast brought to you by Beacon at Salisbury University and BFG Financial Advisors. This is your host, Eric Brotman, along with co-host Renée Winsky, reminding you to stay engaged. Be sure to tune in for new content every month.
You've been listening to Engaging Leaders, a Leadership Maryland podcast. Leadership Maryland is the foremost statewide organization where critical conversations occur in an environment of trust and civility to facilitate actionable change. For more information, visit us at www.engagingleaderspodcast.com. Please subscribe and leave us a review on your favorite podcast platform.